Let's say you have a patient coming in having lots of diarrhea. However, you do everything. Physical exam, vital signs are absolutely normal, laboratory results are normal, and colonoscopy is even done and it's completely clean. You should definitely start thinking about factitious disorder. Do some tests with the diarrhea. Check stool osmolality. Remember, this should be around 290 milliosmoles per kilogram. This is very important. Never forget this because you're going to use 290 milliosmoles per kilogram when it comes to acid-base questions. Check the electrolytes in the stool. Is there high magnesium or phosphate? They could definitely be using laxatives. Lastly, you can check for osmotic gap. This basically means that there's extra things inside the stool, such as lactulose or polyethylene glycol. When the gap is really high, you want to think about laxatives, and if the osmotic gap is really low, you can think about the patient having secretory diarrhea. And just as a quick point of reference, an osmotic gap that's indeterminate is really 50 to 125. If it's less than 50, think secretory. If it's more than 125, think osmotic diarrhea. Just as a very quick summary, osmotic diarrhea is when water is being drawn into the intestinal lumen, versus secretory, just like in the name, you are secreting actively water into the intestinal lumen. And as a flashback to step 1, this means increased CAMP activity. And you often see this in like foodborne infections like EHEC or cholera or C. perfringens or C. diff, Giardia, norovirus, rotavirus, adenovirus, all that good stuff. And again, osmotic, you tend to really just think about laxatives. You can also see it in carbohydrate malabsorption or lactose intolerance. Speaking of malabsorption, if you're suspecting celiac, you should definitely have other things inside the question stem like weight loss or iron deficiency anemia. And again, you want to check for tissue transglutaminase IgA antibodies. Abdominal discomfort and diarrhea after they eat meals, start thinking about a lactose hydrogen breath test. You want to look for lactose intolerance. And I did mention norovirus earlier for chronic diarrhea, but this is really for HIV patients, solid organ transplant patients, basically immunocompromised individuals. And if you're immunocompetent, then it's pretty self-limited and the problem is not chronic.